Sometimes you feel it's just the female that asks questions. The men also ask questions for their wife. I got a man sending me a message. I was like, I don't really know how to speak with my wife. I really want to talk to her. She's having this fishy smell from her vagina. I don't know how to say to her. I don't want to feel offensive. Don't mess me. What can she take? Don't mess me. What could be the cause? I got this from a caring and loving husband. So the husbands are still finding solutions to their wife problem. Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today I'm going to be talking about that fishy vaginal smell, that fishy smell that comes from the vagina. What are the causes? What is it called? What are the signs and symptoms? How can it be treated? And also how it can be prevented. But before we go into details into this class, if you are new on our YouTube channel, if this is your first time on our YouTube channel and your reproductive health is something you actually want to learn about, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Let's go there. Welcome back. Like I earlier said, today I'm going to be talking about that fishy vaginal smell. That smell that comes out from the vagina and is making a lady or her partner feel uncomfortable. That smell is caused by bacterial vaginosis. Bacterial vaginosis is a bacterial infection in the vagina. Yes, bacterial vaginosis is caused by the outgrowth of a bacteria. Before I go into details, before I explain further, I want you to know that in the vagina, there are bacteria naturally found there. We have the good bacteria in the vagina and we have the bad bacteria that are naturally there. You get, the good bacteria is the Lactobacilli. It's found in the vagina and it's very, very good. It's very, very useful to the vagina. And we also have the other bacteria. Normally, this good bacteria ought to be much compared to the bad bacteria. This good bacteria has to be in a higher number compared to the bad bacteria. But if this bad bacteria now outnumber, not increase, is not higher than the good bacteria, bacterial vaginosis occur. So most people say a lady that's having a fishy smelling vagina is as a result of STI. Bacterial vaginosis is not a sexually transmitted infection. Take note, it's not an STI, but bacterial vaginosis, or that cause of that smell, it's actually not an STI, but an STI might increase the chances of occurring, but it is not sexually transmitted. That is not transmitted during sex. That's one thing I want you to know about bacterial vaginosis. And other signs and symptoms of this bacterial vaginosis include the number one sign that we said, which is that fishy smell coming out from the vagina, which is usually very, very obvious, I think, during sex or after sexual intercourse. Then the other one is this burning sensation during urination. Then the other one I have to share with you is itching. Yes, itching is also a sign of bacterial vaginosis. Then thin gray or green discharge from the vagina might be a sign of bacterial vaginosis. So these are the signs and symptoms. So whenever you're having something like that, that thin gray or green discharges, there's a burning sensation, there's a fishy smell, that might give you a signal that, oh, this could be a bacterial vaginosis. This could be a bacterial infection. So then that takes us to the causes. What is likely to cause it? Like I earlier said, it is caused by the outgrowth of the bad bacteria. There's an overgrowth of the bad bacteria. And there's also an increased chances of getting this. Those at risk of getting this BV. If you are a woman of reproductive age, you are at risk of getting bacterial vaginosis. If you also have multiple sex partner, though it is not sexually transmitted, but multiple sex partner increase your chances of getting bacterial vaginosis. Then another one is douching or douching. I'll put the spelling. I'm not an English student. I try to pronounce this thing, but it usually leaves my memory. I don't know why. So douching or douching is also increases an individual's chance of going down with bacterial vaginosis. Then also some women naturally they lack this good bacteria, which is the Lactobacilli. So if you're a woman, you have this lack like a reduced number of these good bacteria, that might predispose you to bacterial vaginosis. Then that takes us to the complications that are likely going to arise as a result of frequent or recurrent bacterial vaginosis. So the first one I have to share with you is preterm birth. Yeah, when a woman is pregnant, this person is having bacterial vaginosis, it might lead to preterm birth, which leads to premature babies being delivered. Then the other one is STI, sexually transmitted infection. Then the third complications that are likely going to arrive, pelvic inflammatory disease. Remember, I told you that recurrent STIs might lead to what? Pelvic inflammatory disease. Then the last one I have to share with you is increased risk of getting an infection after gynecological surgery, after gynecological procedures. So these are the complications that are likely going to pop up when you keep having this bacterial vaginosis. The next thing I have to share with you is the prevention. How do I prevent bacterial vaginosis? The first one I have to share with you is minimize vaginal irritation. Yes, what you use down there, what you are using to wash down there, what chemicals, what soap, what irritants are you using down there? Those irritations increases your chances of altering the normal pH of the vagina, thereby predisposing you to what? Bacterial vaginosis. And another thing that helps to prevent is do not douche, do not douche, do not douche, do not douche. That spelling, that pronunciation, do not douche is on the board. Can you see it on the screen? Yeah. And then the other one I have to share with you is avoid multiple sex partner. Try as much as possible to avoid STIs, that's sexually transmitted infection. Try as much as possible to practice good vaginal hygiene. Not just vaginal hygiene, personal hygiene as an individual, and also environmental hygiene. That is going to go a long way to help. And also my personal advice to ladies out there is that they should put on cotton pants rather than nylon pants, because cotton pants allow air circulation around the vagina. It allows proper air, it allows proper ventilation around the vagina. With that, you might reduce the chances of getting bacterial vaginosis. So for those that have been asking, I hope I've been able to explain it. But before I end the video, in terms of treatment, as you all know, it is caused by bacteria. Definitely your doctor, your healthcare provider is going to prescribe some antibiotics for you to help eradicate, to help kill the bacteria, or to make the bacteria status. They are in a better position to know the type of antibiotics to give to you. So I'm not here to prescribe to you. It's not my duty here to prescribe the particular antibiotics to use. So your healthcare provider will do that. But antibiotics is a treatment, is the run-to treatment for bacterial vaginosis. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mary saying thank you. Bye, and see you in our next video.